Everyone, today is Thursday, October 12th. Thank you so much for joining into our weekly HCR webinar. First things first, I apologize for last week for those of you that didn't get the message or logged in and were waiting for me to show up to the meeting. I got hit by the flu and unfortunately didn't have my information with me, so I couldn't run the webinar even from home. So I truly apologize. So we do have a lot of catching up to do today. I do have a lot on the agenda, as you can imagine, as we get closer to 11/1 and to the rate filings for 2018 becoming released. It gets a little crazy, and of course for those of us that are in the group health market, fourth quarter is certainly upon us. So again, I apologize for the inconvenience last week. For those of you that are new to this format, my name is Deb Wilkinson. I am the Vice President of the Health Plan Options Department here at URL. We run these weekly webinars so that you have a place to come to learn the latest federally and statewide, the happenings with the under 65 market for individual and group, and also, hopefully a place that you can get your questions answered. There's a lot of folks on the call that are in the same boat as, everyone is in this market. And, I think that certainly it's a place where you can hear other people's questions and some of the struggles that they are also experiencing being in these markets. So without further delay, let's get right into the agenda. Just one last note, if you want to ask questions, you can ask questions by typing your question into the question box, and I'll answer that at the end of the webinar, or you can raise your virtual hand icon. It's in the control panel to the right of your screen. Just with a show of hands, if you can let me know if you can hear me all right and you can see my screen. Excellent, thank you, thank you, thank you. Okay, so let's get right to it. So we talked a couple weeks ago about the funding for CHIP and the community health centers. It expired on October 1st. Congress is still working to renew that funding. It's also going to include $1 billion in Medicaid funding to Puerto Rico due to, of course, the devastation caused by Hurricane Maria. That still isn't finalized. I don't expect that anyone left or right in Washington would allow the CHIP funding to go away. So, I do expect that to go through. I don't think anyone expects that it won't have some sort of resolution, but unfortunately, no resolution yet. You probably have already heard that HHS Secretary Tom Price resigned. Right now, the Deputy Secretary, Eric Hargan, is going to serve as the agency's acting secretary. We talked a couple weeks ago about Lamar Alexander now trying to propose like an ACA Repair Act, which would shore up those cost share reductions and, talk about the tax penalty being enforced or not. But at this point, there's no movement on that. Over the week or the last week, President Trump has just narrowed the contraceptive mandate or is planning on it. The mandate allows for basically for more groups to file exemptions from having to cover contraceptives at no cost to the employees, of course. Right now it is a mandate, and there are exemptions that can be filed, aka Hobby Lobby, that an employer, if they have a religious objection to offering contraceptives, are exempt from that. Of course, we all know it's just baked right into the rate, so ultimately everyone pays for it anyway. Governor Wolf went on for Pennsylvania on Monday to call on the state legislature to pass legislation requiring employers to cover contraceptives at no cost to consumers as a preventive service. So it looks like Pennsylvania, one way or the other, it's going to be, or at least proposed to be mandated. Governor Wolf goes on to then conversely say that this decision by the Trump administration to take women's birth control decisions out of their hands and put them into the hands of their employers is wrong. So I'm not sure what the difference is in making it a mandate that employers have to cover it within Pennsylvania, or being critical of the Trump administration for allowing employers to not cover it. So, it's politics as usual. The president is set to sign an executive order. We're hearing tomorrow. What that means for everything for 18, I'm not certain yet. Part of that is allowing association plans, like-minded groups to join together to create association plans, go in as a group. Of course, there are a lot of issues with that. Many of us know that, there were many association plans in the 90s, and that number has significantly dropped. The real problem with it, of course, the concept is great, but the real problem with it is that it is a smaller risk pool, and essentially it blows up much more quickly than the larger risk pools that the carriers are experiencing, for instance, in the small group market or large group market, the medical loss ratios, et cetera. So whether that's a good thing or bad thing, it's yet to be determined. We'll see how that goes. Also, interstate sales, there are some issues with that too. It's really going to reinterpret a provision within ERISA, so that certainly is something that will be looked at stringently. There's also the McCarran-Ferguson Act, which regulates the interstate sales. So not sure how an executive order would get through that. Additionally, you have to file plans for these interstate plans, and only 9 states right now have the ability and have filed for the ability to offer these plans, but they're still not selling. So, again, this was talk from Republicans, even before the ACA was signed on bringing competitive means into a market where a person can go to Montana and purchase a plan if it's better for them. The real issue, I think, too, is that, with the ACA, every plan is the same as far as the essential health benefits. They're all baked in. So where is the advantage of going to Montana now and getting the same essential health benefits versus what you can get in Pennsylvania? And then, of course, the struggle is with the networks, too, and how good they are for everyone to use. So still a lot of things to figure out. Also, there was an email that I just received from one of the short-term carriers, IHC, that basically said that part of this executive order may include the lifting of the 89-day limit on short-term medical plans. Again, I don't know what's going to come of it, but we'll certainly be watching it. Just wanted to at least let you know what is going on. So let's get right into this. In the affordability factor, I want to kind of go to a different screen. In 2018, the affordability factor for employers, so that the lowest cost offered plan and the single only rate does not exceed the 9.56% of the W-2 income. That's the safe harbor. So for 2018, it's actually going down to 9.56 from 9.69. However, you can see that the FPL safe harbor monthly maximum is actually going up because the FPL went up. So even though the percentage of income or FPL is changing or decreasing, it's actually increasing slightly the minimum that can be charged. Hopefully everyone understands that. Also, this information as far as individuals that go to the market and can't find a health plan that is less than 8.16 of the household income, they have the ability to file an exemption from the individual tax penalty, stating that every plan, the lowest cost offered plan on the individual market, exceeds the 8.16. This is 2017 information. There is nothing for 18 yet. I imagine it would be at least 8.16% or higher. for 2018, but I wanted you to at least be aware of those affordability factors. This is an important one. Capital Blue Cross Group Submission Deadlines, they have changed it. There's no longer the late submission letter that was required after the 12th. Right now, they are cutting everything off at the 15th. So if you want a 12/1 effective date, they have to be in by the 15th, or you will get a 1/1 effective date, which of course would adversely affect your rate. And just want you to be aware of that. We'll work with you and do what we can, but please be mindful of these deadlines because we cannot get exceptions. We've been told, and now you guys have been told, this is what we have to deal with. So please be mindful of these deadlines. We want the business as much as you do, but unfortunately our hands are tied as well. So get those apps in, get those renewal options chosen, meet with those groups, and get the changes in by the 15th so that you can secure that effective date. In the news, this was a quick turnaround. Independence and Reading Hospital and Tower Health announced 2 weeks ago, actually less than 2 weeks ago, that the Tower Health facilities such as Brandywine, Jennersville, Pottstown, Phoenixville, and Chestnut were no longer in the IBX network. It would have adversely affected, the Blue Card participants nationally, as well as, Central PA folks in the Highmark network. But that has since changed. The Independence Blue Cross and Tower Health announced that they have agreed to a new 3-year contract. It's effective immediately. So that means that Independence members continue to receive in-network benefits at Jennersville, Pottstown, Phoenixville, Brandywine, and Chestnut Hill, as well as confirming that the Reading Hospital system is also still in network. So it was a blip, but it is now resolved. I just wanted you to be aware of that in case you get questions. Geisinger Group is having a bonus. It is for 11/1 to 1/1 effective dates, and it's for new groups within the 1 to 99 market. If you, any new group sold in the 1 to 99 market segment, again for November 1st through January of 18, will get a one-time payment of $25 per subscriber. That's a nice benefit. If you happen to sell 200 or more new subscribers during this time period, it will bump up to a one-time bonus of $50 per subscriber. You're also entered into a contest for, oh, I'm sorry, that's a different bonus. I'll talk about that later. Just know too that the 1 to 99 eligible employee bonus is in all Geisinger counties except Lehigh and North Hampton. So be mindful of that, please. Let's get to this. Prime Pay. Now this is where I started talking about this other bonus. Prime Pay, who is our Cobra vendor, is having a fire sale, if you will. They are running a promotion from 11/1 through January 31st. They're waiving all setup fees for FSAs, for new FSAs, HRA, HSA, Cobra, or ERISA services. That's up to a $500 value. If you refer a client to them, you'll receive a $100 invoice credit, or they'll receive an invoice credit if 2 or more services become effective. Any new business on the FSA, HRA, HSA, Cobra, or ERISA will have a 2-year rate guarantee. You can get a $100 gift card, and if you're the top 3 referring broker concierge partners, you will earn a $500 gift card. So, I'm sure that the bonus is secondary to this, but I think what the big takeaway is the waiving of the setup fees. That certainly is real dollars talking. All right, so next bullet point, the FFM, new qualifying events for special enrollment period for Hurricanes Harvey, Irma, and Maria. Details are in the newsletter. Essentially, the SEP will apply to individuals impacted by the storms who experienced a qualifying event between 60 days prior to the start date of the incident period and December 31st. and it will be an SEP for those who were unable to complete the application, plan selection, and enrollment process due to the hurricane-related weather issues. These individuals can enroll in a new 2017 Marketplace plan or make changes to their existing plan anytime through December 31st. There's also another hurricane-related SEP for 17 if individuals who reside in or move from areas affected by these hurricanes, they will also be eligible for a special enrollment period that also extends through December 31st. So for those of you in the individual market, just be mindful of that. You know, if you do have anyone moving here that were affected by the storm. Wanted to talk a little bit about Starmark. We are having a seminar in January 24th. It's a lunch and learn. It starts at 11:30. It's going to be here at URL. It's going to talk about reference-based pricing. This is kind of the latest and greatest, and I do think that this is kind of where the market's going. You know, it's still not widely accepted or widely discussed, but it is something that should be in your bag of tricks, if you will, and something that you should become familiar with. So Gino Gambardello is going to be here at URL on the 24th of January for the lunch and learn. He's going to talk about the reference-based pricing, and you know, just be mindful of the products for Starmark when you're looking at your renewals, because with the reference-based pricing, you can get anywhere from 2 to 10% reduction in the rates. Starmark looks at the groups individually. They are not lumped into, you know, a consortium or, you know, a risk pool that the neighbor group down the street is, you know, 500-pound diabetics and your group is taking care of themselves. They're going to get a rate and a renewal based on their specific group's performance. And furthermore, with a reference-based pricing, one of the I guess things that makes employers uneasy is the fact that if the providers won't accept these reduced rates, then ultimately it would come out of the employer's claims bucket. So, you know, no harm, no foul to the employees, but the employer is still incurring those costs. With Starmark, if the providers do not come to an agreement on the pricing, then Starmark eats that difference. So, you know, again, it's kind of risk-free almost. Doesn't apply to all groups. It doesn't fit all groups, but it is something you should be looking at for your 5+ groups. And again, hopefully you can just pencil in that date, January 24th. We also have another a webinar that I'm planning for Friday, November 3rd. I know it's short notice. This is at 9 o'clock in the morning from 10:15. Details will be coming out. They're not in my newsletter yet. They will be coming out. And this is initial training on the Christian Health Share Ministry and the limited medical plan, accident plan, critical illness that is combined with the Christian Health Share Ministries for individuals and families. So target market for those plans are 45 to age 63. They have to be healthy. They have to, of course, agree that they are Christians and they join the Health Share Ministry and also put in a plan. Commission is going to average out about 22%. So it's real dollars. And, you know, it is something that I think you may want to look at. It is for sale all year round. And keep in mind, enrollment is shortened this year, 11/1 to 12/15. You know, again, so you may want to pencil that in as well. So that's Friday, November 3rd at 9 a.m. till 10:15. Okay, moving on. I'm talking very quickly. National General short-term product. They just dropped the exclusions for interscholastic sports on their Triomed accident, CI, and short-term medical products. So that's a good thing. And just a reminder, please watch in my newsletter for the upcoming training because there is training for 2018 for Capital, Highmark, Aetna, and there will be more coming. So that's really the place where I'm putting all of these training sessions that you may or may not want to take advantage of. So rate filing so far, nothing has been released. On the Pennsylvania Insurance Department, I can tell you that, give you kind of a heads up on what has been filed. Capital, there are two different product or filing entities, and one's a little over 12%, one's 13.76%. So I think that you can expect on average about 12-ish% increase on capital if those rates are approved and nothing else changes. Looks like NEPA is about a 10%. Highmark, it looks like, well, there was one for about, almost 20% and one for almost 9%. So again, that's different products, not sure which product's going to get the higher increase. Geisinger about a little over 8% and UPMC just about 8%. So that's kind of what you're looking at on the individual side. But as soon as those rates are released, I will absolutely get them out to you in the link or any way possible. It always frustrates all of us this time of year when you're expected to at least talk semi-intelligently about the options for November 1st, whether you're in the business or not, and there's nothing to talk about even 2 weeks before. So just keep watching and we'll get them as soon as we can. If you have not received from Highmark a link for the litmus program where you go in and you do your FFM attestation for 2018, if you've not received your link in order to complete that, this is the email that you need to reach out to. U65 training certification at highmark.com. If you email them, they will, with your name and your NPN number, they will email you the link so you can go in and complete that attestation. I'm not telling you to do it because I'm convinced they're going to pay commissions on new business, because I'm not. But if they are still paying on renewals, which I believe that will happen, and if you have any renewals, then you, in order to at least protect those renewals and that income, you need to do the attestation. So please take some time to do that. And it's open forum now, so hopefully you have some questions. I put this adorable little black kitty over here because tomorrow is Friday the 13th, so I just want you to be careful tomorrow, and hopefully we can all run across a little cute little kitty like this, not the scary one. So let's get right to the questions, and it doesn't look like we have a lot. Okay, looks like Margie just wants some information on what Prime Pay is offering as far as their specials. And that's it. Those are all the questions I have today, or that have been submitted. As always, I appreciate you joining in, and we'll be back here next week on the 19th with hopefully more information, possibly rates, let's hope, and hopefully more information that's useful to you. So as always, I truly thank you for joining in, and hope that you have a great balance of the week and a wonderful weekend. Bye-bye.